We are about to get started, and thank you all for carving out some time this morning to join us for this very important conversation. Today we are joined, and I'll talk a little bit about their backgrounds later, but by Dr. Corey Hebert, who is just a renowned physician here in the New Orleans area, and the chairman of our board, the RTA's Board of Commissioners, Mr. Flozell Daniels, is here as well. And I'll share a bit about their backgrounds a bit later, but in opening up this conversation, I really want to go back to where we were at the beginning of 2020, and in particular, those first few months. And we all of us, were either affected or know someone who was affected by COVID-19. And as an organization, I could not have been more proud as the leader of this organization to partner with all of you, including our board, to respond to COVID-19. When I take you back, realize that we were reacting in real time to a threat we didn't quite understand. We didn't understand the severity of it. But to my left is my board chair, my boss, and we had many late night conversations talking about how do we do two things. How do we protect our employees, and how do we protect our staff? And then consulting with medical professionals to help us reach that decision. Concurrent to that, the staff in our maintenance department on bus and rail, I love y'all. I can't thank you enough because you didn't ask for permission. You just went ahead and started to design and construct barriers to keep our operators safe. And you did that on your own. And that, to me, is true leadership. And so this entire organization came together during a time of crisis. We were learning on the fly, reacting as we go, to make sure that we could take care of each other as a family. And unfortunately, we lost 3 employees. And we haven't had time to properly grieve them yet, but I assure you, we will, and when it's safe to do so. So this organization has been through a lot. The last year has been extremely challenging, but we're still here, we're still standing, we are still supporting each other, and we're still providing transit mobility for the region in New Orleans, the city of New Orleans. And so I can't thank you enough for your dedication and your partnership. And we're going to get through this, y'all. We are absolutely going to get through this. And so today's conversation is going to center on the vaccine and how it will help us to mitigate, of course, COVID-19, and most importantly, provide an opportunity for staff to ask questions to Dr. Hebert about the vaccine and how it will affect the COVID pandemic. So first, let me introduce our chairman. As many of you know, Mr. Chairman Flozell Daniels is a staunch advocate for transit in our community. In the current role at the RTA, he leads this organization, has led us through some very challenging times. He's also the CEO and president of the Foundation for Louisiana. He's a public policy and community engagement strategist with deep expertise in equity models that support community development, resilience building, legislative strategy, and leadership development. In addition to serving as the chairman of the RTA Board of Commissioners, Chairman Daniels also serves on the board of the Orleans Public Education Network, as a board member emeritus of the Urban League of New Orleans, and serves on the Louisiana Public Defenders Board and the Governor's Climate Task Force. And to my right is Dr. Corey Hebert. Can't say enough about this brother. Absolutely known as the doctor for the people. He's really been at the center stage and the forefront of helping all of us in this region survive this pandemic and answer our questions along the way. He's an assistant professor at both the LSU Health Sciences Center and Tulane University Medical Center. He's a highly regarded medical broadcast journalist, working as an on-air medical editor for NBC Television in New Orleans, the Gulf Coast, and is also a fan favorite on MSNBC. And so with that, we're going to begin our conversation. I'm going to turn it over to our chairman, Mr. Flozell Daniels.
Fantastic. Thanks, Alex. How y'all doing? Fantastic. Thank y'all for joining us. I am just delighted to be here. One of the things I love about working with Alex is when you follow him, you don't have much to say because he has nailed everything. I just want to share the gratitude that we have. Dr. Hebert, you're looking at a sampling of the Dream Team. This is just a few of the folks who, when this pandemic hit us, we knew we needed to rely on our people as we did after Katrina, as we've done in other hard circumstances. And they showed up. They gave us the information, they gave us advice, and I'm also grateful for Alex and his leadership team for doing the work. You guys did this work, day and night, day in and day out, and quite frankly, pushing and making sure what you needed to be safe is what you got. And I'm really glad we had folk like Corey and others who were helping to advise us in moving this. We had a standard. We wanted to be the best transit agency in the country when it came to how we responded to this awful pandemic, even understanding that we didn't know everything that we wanted to know at the time. And now that we have a little bit of a chance to look back on it, you guys helped engineer one of the best responses in the country, not only keeping yourselves safe and your colleagues and your families, but keeping our riders safe and helping us make sure that people could get to work, get to school, get to their health appointments, and all of the things that we know public transit provides day in and day out. I'm extremely glad to be here to have this conversation on behalf of the board. We are not only proud, but we are gratified. We are also looking forward to not only getting through the rest of this pandemic. This is the year we're going to beat this thing. But we're looking forward to 2021 being one of the best years the RTA has ever had. You guys are at the heart of that. And so I'm just going to ask if Dr. Hebert could say a few words, and then we'll jump into the conversation.
I have on two mans. A lot of you may recognize me from television and being around, boots on the ground here, but what you see on television is me. But me is a little bit more, because I am not from New Orleans, but I'm of New Orleans. I've done everything that could possibly be done here, and I am with you. So as a non-native son who has adopted this city, I just want to thank you. That's the first thing. Flozell, Alex, I want to thank you. Ms. Felton, I want to thank you. And the reason why is because we talk about frontline workers all the time. And we say nurses and doctors. But how the hell did the nurses and doctors get to work? How did the people that are taking care of the patients, as well as the people that are cleaning up the hospital, get to work? The people that are sitting at those front desks at the hospital, how'd they get there? So you are frontline workers. Make no mistake, you are frontline workers, just as important as me. We all are important, and we all have a real important job to do. So with that being said, we can jump into this because there's no reason to sugarcoat any of it. We've been through hell. And as a matter of fact, I find myself, I don't know if you guys find yourselves saying, after the hurricane, after the Katrina, I say all that and I forget that this is a pandemic and not Katrina. Because to us, we've kind of been through something like this. We've been through the fire. The problem is, with something like Katrina, you know, you have this finite thing that will get you to the next level. Here, this is biology. This is science. And it's scary. It's very scary to people that really don't, have not been submerged in this concept for a very long time. Somebody like me, I've been in science for 25, 30 years. And so I'm used to this terminology and these words and monoclonal antibodies and all this kind of stuff. But most people are not. So my job as the doctor for the people is to be able to bridge that gap so that you can understand in plain English what's about to happen and what has been happening and what has happened. And that's what my job is today.
Fantastic. Thanks, Dr. Hebert. So we're going to jump right into this. I want to make sure you guys understand this is a participatory process. We understand folks may have questions, want to make assertions. We are looking to you to participate. So while we have Dr. Hebert here to answer any question you may have, nothing is off the table.
The only dumb question is the one you walk home with unanswered. That's the only dumb question that's here, all right? So look, don't, I mean, I had one, hey man, well, if COVID-19 is so bad, well, what happened with COVID 1 through 18? COVID-19 is because it was the year 2019 when it started. It had nothing to do with 1 through 18.
Right.
But people don't know that.
That's right.
So there you
That's
go.
right.
I'm breaking the ice.
We're gonna break the ice. We have a question from Shalon and safety. We'll get started. We'll jump right into this thing, Dr.
Sure.
Hebert. Are there potential side effects for individuals that are taking meds for pre-existing conditions, such as high blood pressure, diabetes, or congestive heart failure? And should an individual consult their physician prior to taking the vaccine? It's an excellent question.
Yeah, so let's just start off by saying, and I'm gonna open this question up a little bit, because that's really the crux of the matter. Vaccines have been around a long time. And I also want a lot of people here, I see a lot of brown people here, I see white people here, I see some Asian people here. I just kind of want to give a little bit of background on vaccination. Okay, in the early times of our country, there was a smallpox epidemic, and there was a man named Cotton Mather who was a slave owner. And he had a slave named, I forgot his name. I'll get back to that because I know his name real quick. Anyway, he obviously had been brought here, and people were dying from smallpox. I'm going to give you the abridged story of this. So when people were dying, he told his slave master, look, in Africa and other parts of the world, we do this thing where we just rub on the sore from the lesion from smallpox, and then we rub somebody else and break the skin, and those people didn't die, right? And Cotton Mather, who was the white slave owner, said, well, that's interesting, but yeah, you just keep that to yourself, till more people started dying in Boston, okay, Boston, Massachusetts. Then when his family started to get really sick, he said, well, you know what? This slave may have something on, so we might need to try. So they did that, and his family didn't get sick. And they started doing it to other people in Boston, and they didn't get sick. But he was a slave owner, and this man was a slave, so nobody believed it. So fast forward, the smallpox pandemic went through the country, thousands, millions of people sick and dead, and other people started using this technique, okay? And it was called variolization, not vaccination, because variola was the virus that caused some of the other illnesses. So then another doctor, a little bit later, a little bit more advanced in this whole concept, decided that they wanted to try this because this made a lot of sense. And they couldn't use smallpox because smallpox killed you, so they used something called cowpox. And what they noticed is that if you did that exact same thing to a person that had cowpox and then rubbed it, then the other person wouldn't get cowpox. And the Latin word for cow is vacca. And that's where the word vaccination comes from. So we owe it, really, to a black slave, Onesimus is his name, Onesimus, to actually bring vaccination to this country. So we have to know our history about all these types of things. And so, a lot of times, historically, African Americans don't like vaccines because because of the historic issues, and we'll talk about that later. But to her question, if you have anything and then you want to take anything else, then you should always talk to your doctor. And most of y'all don't go to the doctor anyway. And we got to change that. 80% of people that have insurance don't go to the doctor every year because you're scared. Because you all remember Miss Mary. Miss Mary had that swelling, then she went to the doctor, then they cut that tumor out of Miss Mary. And as soon as that tumor hit the air, as soon as they let the air hit the tumor, it spread. And then y'all don't want to go to the doctor because that's what killed Miss Mary. Nope, that's not what happened. Miss Mary had that tumor for about 20 years and never went to the doctor. That's what happened. All right? So always consult your physician before you do anything if you are on a blood pressure, hypertension, whatever medicine, always. The second thing about this question is, are there side effects? And there are side effects to anything. And I just want you to always remember, before this pandemic started, and you got a vaccination for zoster, or you got your pneumococcal vaccine, or you got all these vaccines, did you read the package insert? No, you didn't. Before you take Tylenol, do you read the package insert? No, you don't. But Tylenol is one of the most dangerous medicines in America. It kills more people than almost any other medicine in America. But you pop it like it's candy all day. Motrin, same thing. If you happen to take one Motrin, you can get a disease called Stevens-Johnson syndrome. All your skin falls off, your lips fall off, and you die. But you take that like M&Ms. Okay? So just look this stuff up. You need to look it up. So what I want you to understand is that the reason why you're so upset and antsy about this thing is like you are starting to learn about it every day on the news. So you're like, oh, I'm nervous, I'm scared. This vaccine took about 1.5 years, 2 years, in quote unquote development, but we've known about this type of vaccine, mRNA vaccine, we'll get to for a very long time. Since, SARS, the first SARS, this vaccine, this illness, COVID-19, is SARS-CoV-2. We've already had SARS before. It just wasn't something that we were too concerned about. But just remember that we've had this type of information and this type of vaccine before, and just always remember that children 2 months of age take 5 vaccines at a time. 2 months, 4 months, 6 months, 12 months, 15 months, 1 year, 4 years, 11 years, 16 years, 5 vaccines at a time. Okay, so just remember that. And what we will not stand for again is everybody's concerned because, this vaccine was too fast. That shouldn't be the problem. What you need to be worried about is why other vaccines take 8 years. Because they don't take 8 years in other countries. I will never stand for another vaccine, because you know what we can do when we really want to, get one out in 1 year. We will never stand for another 8-year development of anything, because that's red tape and bureaucracy.
Yeah, I appreciate that, Dr. Hebert. And one of the things we want to point out is so many of these concerns are based in realistic inequities, whether they be racial or gender inequities in America's healthcare system over years. And part of what Dr. Hebert is saying is we have evidence that that's not what we're dealing with this particular vaccine. And at a national level, there have been folks like Corey and others, quite frankly, folk that look like the people we're most concerned about, physicians and researchers who've been deep in the process making sure that everything was done the way it was supposed to be. So I've been on some of these other calls. Alex has been on these calls with the national transit agencies. And so there's a lot of safety there. Corey, just a quick follow-up, just a 10-second thing. How many vaccinations have been given so far today? What are we, 3, 4 million? How many?
Yeah, we're close. Well, so the information will lag a little bit,
yeah,
but we're between like 4 and 6 million.
And how many people have had a serious issue so far? Because one of the questions we have is allergic reactions to the vaccine.
Yeah.
It's been incredibly small.
Yeah, we've had a few dozen. I want to mention one of those real quick. One of the side effects is called Bell's palsy. It's a transient, like one side of your face might droop. Okay, so of the vaccine of the study group, 77,000 people were in these studies. About 7 people got Bell's palsy. Okay. Now, what you don't know, once again, because you're not exposed to this stuff, is that people get Bell's palsy every day not from vaccine. You get Bell's palsy from just a viral infection. So the odds of you getting Bell's palsy just from walking around in New Orleans is much higher than you getting Bell's palsy from the vaccine, but you don't hear that. You don't hear that, right? So a few dozen people have had some reactions. We usually have given them some epinephrine, and a couple people had to spend the night in the hospital. And they've gone home. So nothing crazy. Now there were a couple of things I just want to address. There are 2 people in Norway, 2 older people that got the vaccine, the Pfizer vaccine, in nursing homes, and they died a week later. But the incidence of people in nursing homes dying in Norway was the same incidence as people that would have normally died anyway. And then there was one other doctor in Florida, a healthy OBGYN who got the vaccine and then a few days later died of a stroke. But 56-year-old high-stress men that are doctors die of strokes all the time too. So you have to think about things being temporal, meaning something that happens over time, or causal, meaning did this cause this? And there are lots of things that are temporal and not causal.
Fantastic. Okay, that makes a lot of sense to me. So you mentioned Pfizer. So one of the questions we have from a member of the team is that many pharmaceutical companies have developed vaccines with various effectiveness rates. Is one vaccine better than the other, and which vaccine are you going to receive?
Very interesting, very interesting. I consider myself a medical guinea pig because I hate to be gross, but people have thrown up in my mouth for the past 25 years. Look, you bring it on. I'm over it. Bring it on, right? So I got the vaccine 4 months ago. Neither one of the Pfizer or the Moderna, because I'm a principal investigator for a vaccine trial. So I was like, if I'm gonna, talk the talk, I gotta walk the walk. Load me up. So I got the vaccine when you could only get it when you were in a study. I didn't have any side effects. That's the Sanofi vaccine. It's not out yet. It'll be out probably in May. The vaccine is going to have different effectiveness for different people. We know that the companies that came out actually released the data. They were 94.5, 95%. But never forget that this is a business. Never forget this is a business. So one company came out and said theirs was 94.5. Then the next company came out and said, mine's 95. Really? Really? Come on. Come on. But it doesn't matter. 94.5, 95, pretty good. The one that's going to be coming out, AstraZeneca, and should have come out in February, maybe coming out in April now because there was some data issue involved with the way they reported the data. But between 70 and 80%, that's where we're thinking that effectiveness falls. But, sometimes the flu shot's like 30%, but we have a vaccine like the MMR, measles, mumps, rubella vaccine, it's like 97%. You see what I'm saying? So these things vary, but there is no particular vaccine that is going to be better for one person versus the next person. They're just very different. So the mRNA vaccines, which are the vaccines that are available commercially now, those vaccines use an mRNA as like a Post-it note in your body. So you put the Post-it note in there, and then the antibodies are made to the spike protein in the COVID-19 SARS-CoV-2, and then you start making antibodies so that you can actually be protected. That's how it works.
So one of the questions we have that I think is a great one, and to your point about the flu shot, is this a one-time vaccination, or do we believe the COVID vaccination, is this going to be something that becomes a part of the annual way we think about life? And do we know that question, that answer yet?
Yeah. If anybody ever, if you talk to a doctor and they don't tell you the words, I don't know, at least 3 times in the conversation about COVID-19, run. Because nobody knows it all. Nobody knows, and the things we're learning right now, like when this thing first started, we did not know that you would lose your sense of taste and smell. We did not know that. That is new, and that's great, right? But it is, it's real. So, do we know if this is going to be a yearly thing? We know about coronaviruses. Coronaviruses generally cause colds. The reason why this virus is not something that is just causing a cold is because nobody had immunity to it. Nobody had ever seen it in humans. That means nobody ever got antibodies to it. So I'm going to give you just a little background of this science, okay? Why aren't children as affected? Well, children have very strong immune systems, especially toddlers, but they've never been exposed to anything. That's why they get exposed, they make antibodies, so they're sick for 5 or 6 days, but they're constantly sick because they're constantly making antibodies because they're constantly being bombarded with new things that they don't know as far as their immune system. Older people don't really have good immune systems, but they rely on those cells that were exposed a long time ago called memory cells, so that when they get exposed to something, they will make antibodies to it, and then they will fight off the illness. So the worst case scenario is a virus that no one has seen, because the old people don't have good immune systems, and they don't have the ability to make the antibodies because they've never been exposed to it. Children got exposed to COVID-19, made antibodies just like they normally did, and move on about their business. Old people cannot do that. The older you get, the less you can do that. That's why this is happening, okay? So, will we need it every year? We are not sure. You probably will need it next year. But I'm hoping because this virus is not a very complex virus, I'm hoping that once we reach herd immunity, that it'll be something that you can opt in or opt out to get. But I cannot be 100% sure.
We just don't know yet. And Dr. Hebert, can you follow up, because there's been some discussion in the media, and you guys have to let me know if you can hear me or not, about the difference between the infection rate and the death rate and who is more likely to die from infection, right? So you open this saying we've got lots of diverse
Yes.
folk on our staff, but everyone may not be as susceptible as others. What do we know so far about how this sort of inequities that we see happening?
So if you live in close quarters, we know that you are more prone to get infected. We know with this new strain, it's not more dangerous, but it is more infectious, so the closer quarters. So that means you have to look at people that live in closer quarters that may not have as much money to live in bigger quarters, that may not live in sprawling suburban areas, but live more urban. You also have to look at people that have more pre-existing illnesses, right? So we're looking down the barrel of some rural people that have a lot of pre-existing illnesses, white or black. We're looking at people of color in urban areas that live very close. People of color have more pre-existing illnesses, and that's the group that is more susceptible. But at the same time, we don't know that there is that the virus has some racial predilection. It's not really that. It's just that if you have a pre-existing illness, then the virus is going to come and get you more, and that's what we do.
That's a real thing. I want to come back to that and talk a bit about environmental circumstances, but I'll come back to that. So I'm going to actually pivot a bit and ask Alex a question, but before I do, I want to look out at the audience and just ask if you guys have questions. I want to make sure you're getting those ready and you can raise your hand. It looks like there's one in the back. Is that you raising your hand? Yeah. Can you come up to the
Come on up.
Come on up to the microphone. Yeah. We're gonna do this family style just to make sure we're getting feedback from you guys.
You are the next contestant
That's
on the
right.
Price is Right.
I appreciate it.
Come
on. Yeah, speak right into it.
I'm sorry. My question is that my mother is 73. She had a stroke in 2009. She also stage 4 cancer. During that time, she also had a blood transfusion. Her immune system is very weakened because of it. How will this vaccine affect her in that regard? Because I'm terribly concerned about it. And she also rides public transportation against my advice. My brother and I rather take her versus her getting on the bus and going about her business. But she's very independent.
Yeah.
And she wants to do things on her own.
Okay.
So I'm concerned about the side effects as
Yes.
a result of.
That's a great question. There we go. If you, I get a little bit closer. If you are in any way immunocompromised, so I kind of have to know a little bit more about her white blood cell counts before I can say specifically the answer to the question. Because if you are immunocompromised, the odds are you still could take the vaccine. But especially with cancer survivors, there are very specific things that you have to kind of look at. So for example, the absolute neutrophil count. We have to know what those things are before we would say that. Really the only contraindication for anybody to take this vaccine, either one of these two that are out right now, is really if you've had a serious allergic reaction to anything. Now, what does a serious allergic reaction really mean? It's kind of relative, but what we will say is that if you know what an EpiPen is, if you have one, then you should not take the vaccine. If you have ever had one and you just haven't been back to the doctor to get one, you should not take the vaccine. If you have had anaphylaxis in any way, meaning you ate something, came in contact with something, and you could not breathe and you had to go to the hospital, that is a serious allergic reaction. You having watery eyes and allergy problems from the pollen at City Park, that's not a serious allergic reaction. So it's a very unique situation. Your mother say is that you, I would lean more towards taking that vaccine because if she gets COVID-19 with all those things, it's not going to be a really good situation.
And Dr. Hebert, is this one of those instances where his mom, thanks sir for asking that really great question, and I think is relevant for a lot of folk, where his mom really should check with her cancer physicians to get advised on an approach. Is that
Yeah, yes.
You said that earlier.
And everyone before, if you're not taking any medicine and you want to get the vaccine, the odds are you probably can't get the vaccine right now because you're probably young and it's not really available for you. But if you're over the age of 65 and you do have pre-existing illnesses, you should be talking to your doctor anyway. But you should run it by him or her so that you can kind of get some clarity on what your particular situation is.
Lona?
So I have at least two questions.
At least.
Vitamin D, should we be taking it? Because lots of people have talked about it improves your immunity. And then the other question is, if I take, for those who can take the vaccine, what does that do for them? Should they still wear masks? Does that allow them to all of a sudden walk out unprotected?
Two good questions, and thank you. And I thank the young man in the back that asked the question as well. Okay, the first question is the vitamins that you need to take. We've had some evidence that the following vitamins will help boost your immunity, and especially some of them, they've been infused in other countries at very high doses. So, vitamin D, vitamin C, vitamin A, selenium, zinc, and quercetin. Those are the things that you need to take. There will be some things on the market very soon that have those vitamins in high doses, just those vitamins. So look for those. But those are the things you should take. There's some anecdotal evidence to that.
Can you say the last one again?
Quercetin, Quercetin, quercetin. Now, the second question is, if you take the you can piggyback on that. If you've had COVID-19, should you take the vaccine? Yes. And the reason why is because we don't know how long neutralizing antibodies last. So if you had COVID-19 in March, we know that that your antibodies could be gone in about 30 days, so you're not protected. So you need to take the vaccine, even if you had it. And the other question is, once you had it, are you invincible? And the answer is no, you are not invincible. And the reason why we want you to make sure that you still wear your mask is because you may be slightly more invincible, but the ability for you to get exposed and spread COVID-19, we don't know if that's inhibited by the vaccine yet. So you're kind of wearing the mask at that point, at least for about 3 months. You're wearing it for other people. You're not necessarily wearing it for yourself because you theoretically should be protected.
Great. Thank you for that. Hold 1 second for me, because I want to get into this question that I think only Alex can answer. One of you asked, is the vaccine mandatory for personnel?
Great, thank you for that question. It's a very, very good question, and a question that the industry and my colleagues have been discussing for quite some time. What I can say is that it will be highly, highly, highly encouraged. And the reason I say that is our staff are essentially frontline personnel, just as Dr. Hebert mentioned, and our operators in particular are encountering thousands of people every day that they don't know, that aren't part of their family units, that they have no idea what their medical background could be. And so we will be working very closely with union leadership, very closely with the management team, very closely with HR and safety to really encourage everyone to take the vaccine. But will it be mandatory? No, it won't be mandatory, but again, highly encouraged.
Fantastic. And Corey, are you finding in the healthcare industry, is it mandatory where you guys are working?
It's very interesting. If you're in some type of public institution, I really can't make anything mandatory where I have to inject you with it against your will. That's a hard hurdle to hop, right? But we can make it pretty difficult for you if you don't want to do it in situations like, I'm the chief medical officer of Dillard University, so some students want to come to Dillard and live on campus and not get a meningitis shot. And they just really don't want to get it because they just don't want to get it. But I cannot say that they can't come to Dillard because that's their right, because we get public funding. But what I can say is that you can't live on campus because that's just a right. I mean, that's a privilege, not a right. See what I'm saying? So I just want to piggyback on that. If you don't want to get the vaccine, I just want you to sit back and ask yourself why. And if there's a question that you need answered about that, then bring it. You know, because if you don't want to get it, there is a real reason. You can't, and at this point in life, you can't just say, oh, I just don't want to get it. That's really not good enough answer for almost anything as an adult. If you don't want to get it, you need to say why, and then see if we can come to some purposeful solution.
And part of what we're doing here today is opening this conversation to really be able to make sure that folks get the answers, because all of your concerns and questions are legitimate. And we want to make sure that we get a chance both here today, but also in follow-up with Alex and the team to make sure that we're getting really good science-based and